AAPD 2020 Leadership Awards Gala, March 10th at the Washington Hilton. A young woman walks past an Indiana University sign.
My name is Sneha Dave. I am currently a senior at Indiana University. I currently live in Bloomington, Indiana.
Sneha climbs a rock wall at a gym.
A huge part of my life is climbing and hiking. I really enjoy bouldering and rope climbing as well.
Sneha at Mount Kilimanjaro.
My family and I, together, we had the opportunity to climb Mount Kilimanjaro in December 2017, which was quite a feat for me personally because just a couple years before I wasn't even able to walk up the stairs by myself. So I was diagnosed with severe ulcerative colitis when I was 6 years old, and I had, periods of inflammation which caused me to miss school and everything throughout elementary school, but it wasn't until middle school that I became really sick. I started partial schooling. I was in and out of the hospital constantly. I kind of lost that social life that a lot of kids have while they're growing up. It wasn't until my freshman year of high school where I really started to become more aware of the importance of advocating not only for myself but for others. It was then that I had started a newsletter for young adults with inflammatory bowel diseases. I, with my late best friend, we distributed the newsletters around the state of Indiana just to connect young adults with inflammatory bowel disease and to kind of share the shared experiences that we have in terms of navigating social life and living with an invisible illness. Right now, I am working on Health Advocacy Summit, which is a nonprofit organization that I started my freshman year of college at Indiana University. We started off just hosting a very, very small event just to bring together young adults with chronic illnesses, and we soon expanded within 2 years to now being in 6 different states.
Youth participate in the Health Advocacy Summit.
We facilitate advocacy events and year-long programming for young adults with invisible, chronic, and rare illnesses. We have about 15 or 20 people on our team, and we work facilitating these summits all across the country and really working collaboratively with a lot of other young adults to create systems that haven't been there for us.
Sneha stands near a sign with the Health Advocacy Summit logo, then poses with a fellowship participant.
We also facilitate an international fellowship program for young adults, more specifically with inflammatory bowel diseases. We have 8 fellows that we've selected this year from India, the UK, and all across the US, and they get to hear from monthly speakers. They write monthly content for our website, and then they're also going to be attending a national IBD conference in Chicago. And with the support of AAPD, we're so excited to be able to expand to more states and create more year-long programming for young adults who are transitioning from pediatric to adulthood with chronic and rare illnesses. There's a lot of room for improvement in advocacy for people whose disabilities might not always be seen. So I think just being able to include more people with chronic illnesses, and especially young adults and adolescents that have been historically forgotten within the disability community in general, we're really excited to bring that voice, and we're really looking forward to working with AAPD to further the mission of disability advocacy.
AAPD 2020 Leadership Awards Gala, March 10th at the Washington Hilton.